And without further ado, I am happy to welcome our keynote speaker, Amanda Baskwill, to introduce herself and kick off proceedings. Over to you, Amanda.
Well, hello. Thank you so much, Karen, and good morning, everyone. I am really grateful to be here today. I'm just going to get my presentation up. There we go. And excuse me, I feel a little bit like we're going to use references, so we'll see if you know this one. I feel a little bit like Doctor Who today. Not sure if that's a common reference, but I'm traveling across time and space to be with you here, and I couldn't be more grateful. Um, After I graduated from my massage therapy program, my professor, Trish Dryden, invited me to work with her as a research assistant. I admired Trish so much, and I still do. She's one of the most influential voices in massage therapy, and I jumped at the chance to keep learning from her. One of our first projects explored massage therapy for individuals experiencing high-risk pregnancy in hospital. Our very first meeting with the research team took place actually at the hospital. Trish walked confidently in the room, and I trailed behind, just trying to look like I belonged. Then the doors opened. Physicians, a nurse, an occupational therapist, and hospital administrators entered the room. And with each arrival, I just shrank further into my chair. But soon the discussions began, and the team was debating what kind of study to do, what data to collect, who should be involved, and how to make it all work. I listened wide-eyed as these seasoned professionals collaborated on the design of a project that would ultimately bring massage therapy into the hospital for this deserving population. Looking back, what strikes me most is this. It was the shared language of research that created common ground. Titles and hierarchies seemed to fade, replaced with a focus on the work itself. And research gave us a way to speak as equals, and that's what made the project possible. Thank you so much for inviting me to be a part of your event today. My name is Miss Amanda Baskwill. I use she, her pronouns, and I live, work, and play on the lands governed by the Dish with One Spoon Wampum Agreement. I affirm and thank the Haudenosaunee, the Anishinaabe, and the Huron-Wendat nations for their continued caretaking of the land. So I'm coming to this session wearing a few different hats today. I come as a researcher, a former massage therapist, an educator, and an advocate for massage therapy within all types of healthcare teams and systems. Each of these roles has shaped how I see both the opportunities and the challenges for our profession. As a researcher, I've seen how evidence creates a shared language that allows different professions to work together. As a massage therapist, I've experienced what it feels like to be underestimated or left out of these conversations. As an educator, I've supported new practitioners as they try to find their footing in complex systems or teams. And as an advocate, I've pushed to make sure that massage therapy is included where decisions are being made about care and the future of health professions. And that's why I'm excited to talk today about research. Not research as something distant or intimidating, but as common ground, a place where we can connect with other professions and stand alongside them as equals. This session is about imagining what it could look like for massage therapy and how each of us can take steps to strengthen our position in interprofessional care. So before we go further, let's take a moment to talk about what we mean when we say interprofessional care. At its core, interprofessional care is about different professions working together, not just alongside each other. It's a way of practicing that recognizes the unique contributions of each profession and brings them together to improve outcomes for patients, families, and communities. Each of us carries a professional identity, which is the way we see ourselves as massage therapists, or nurses, physicians, social workers, or any other role. That identity is shaped through our education, our practice settings, and the stories we hear about our profession. It's what tells us this is who I am, this is what I do, and this is where I belong. Now, here's where I think it gets interesting. When professionals work together over time, they don't just hold on to that individual professional identity. They also begin to form an interprofessional identity. This is a sense of belonging to a team that's bigger than any one profession. And it's built through learning, through collaboration, and through mutual respect. Tong and colleagues in a 2022 study reported that interprofessional identity doesn't replace professional identity. It develops alongside it. New graduates, for example, first build confidence in their own profession, but over time, they learn to carry both identities together. The professional identity anchors them, while the interprofessional identity expands their perspective to include shared goals and team-based care. Here's the challenge. Massage therapy hasn't often been included in those interprofessional spaces. So we haven't had the same chance to develop an interprofessional identity, and others don't often think of us within their interprofessional identities. And that's why finding common ground through research matters so much. It's a non-traditional way we can begin to step into that shared team identity. When massage therapists feel underestimated, it's easy to think people don't value what we do. But more often, the real issue is that we aren't speaking the same language as other health professionals. Many health professionals are still educated in silos. Doctors train with doctors, nurses with nurses, social workers with social workers. Each group learns its own language, culture, and sense of identity, but rarely do they learn with or about each other. It's not that this never happens. It's just not the most common way that we approach education. Massage therapists are often left out of those interprofessional learning spaces entirely, which makes the gap even wider. Part of how interprofessional identity is built is through othering, and that makes this kind of tricky. We learn who we are as a profession partly by learning who we're not. Doctors are told they're not nurses. Nurses are told they're not social workers. And massage therapists, if we're mentioned at all, are too often defined by what we aren't. Not clinical, not mainstream, not essential. That makes it even harder to step into conversations as equal partners. Brett and colleagues have pointed out that interprofessional education works best when it's built on common competencies. They talk about things like communication, ethics, and public health that every profession shares. I believe research can serve as that same kind of common ground. Research is its own language. It's recognizable, it's structured, and credible across professions. And unlike practice, where hierarchies can be rigid, research invites us to work together in new ways. In a research team, the roles are different. You have your principal investigator, your co-investigator, collaborators, participants, reviewers. These roles are not owned by one profession. So they create a new space where massage therapists can contribute as equals. Both my master's and PhD focused on health research methodology. By that point, I'd already conducted several studies with Trish, and I'd seen the power of research to bring people together. But I'll never forget one experience in my PhD program. I'm sure you've all experienced those dreaded roundtable introductions. Well, on the first day of a mandatory research class, we went around the room one by one. People introduced themselves, and we had our emergency physician, an oncologist, an endocrinologist, another ER doctor, a neurosurgeon. By the time it came to me, the last three were an occupational therapist, a physician assistant, and a massage therapist. Somehow we had gravitated together, the three outsiders. Unfortunately, the room got a little frosty after that. For weeks, our ideas were dismissed as irrelevant, our professions were questioned. The focus was always on treatment rather than the research and the research methods themselves. But when we hit the qualitative methods section, it was different. This was our territory. The three of us had more experience, and the professor recognized our contributions. Suddenly, the same classmates who had doubted us were now asking for our help. Slowly, the respect grew. By the end, people were curious, not dismissive about our professions, and some even began exploring how massage therapy and other outside practices showed up in their own work with patients. That experience confirmed something for me. Research gives us a language we can all share. It takes us out of our rigid hierarchies and into conversations where different professions can meet as equals, focused on the work and the questions in front of us. And there's something else. Engaging in research doesn't always mean running your own large study. There are many roles that massage therapists can take on. You might be consulted on a research protocol because of your expertise in practice. You could join as a co-investigator on a team project. You might contribute by collecting data in your clinic or helping to interpret findings in a way that makes sense for patients. Even participating as a subject in a study or reviewing articles for a journal are meaningful contributions. Each of these roles helps us learn and use the shared language of research, and each one builds our place as partners on the team. So when we're talking about strengthening massage therapists' place in interprofessional care, research can be the common ground that connects us to other professions on equal footing. But the reality is that the word research means very different things to different people. I personally enjoy research, but I know that's not the case for everyone. So I wanted to take a quick look at what it means for us in this room. So we're going to use, hopefully, again, we're going to cross all of our fingers and toes that the technology is going to work. So I invite you to, if you're able, open a browser and go to menti.com. That's the platform that we're going to use for these next few questions. And when you get there, you should be asked for a code. And if you can see the code on the top of the screen, it is 62814446. And I'm going to cross my fingers that we'll see people pop up in the bottom. Oh, good. I see a couple of people joining. Amazing. So when you get there, just type in the first word or phrase that comes to mind when you hear the word research. There's no right or wrong answers. Be totally honest. You might put in statistics or exciting or even run away, whatever it is. We want to see it. And we're going to watch all of the ideas as they come into this word cloud. So this is great. We've already got a lot of fantastic words. Curiosity, learning, academia, reading, data, details, the infamous randomized controlled trial, RCT. Learning is getting bigger. Yeah, there's a lot of learning in research, that's for sure. Data, credibility, open-mindedness, brainstorming, evidence, information, hard work, you got it. But it's less hard work when you get to do it in a team. Analysis, statistics, peer review, study, effort. Dedication, investigating, a lot of time and work. This is fantastic. Informed. All right, I don't want to stop the great ideas coming forward, but I want to switch to our next question, which is about your comfort with actually engaging with research. So I'm going to move to the next question now. So how comfortable do you feel reading and making sense of a research article? Are you lost in the abstract already? Do you skim the headings, hoping for the best? Can you wrestle your way through it? Can you usually get the gist without too much trouble? Or are you highlighting, note-taking, and loving every minute of it? If you're lost in the abstract already, know that this is where we all start. So welcome. You won't be there for long. It's great to see that there are a lot of people who feel that they can wrestle their way through it. Still today, some articles, I still feel that way. And we've got some folks who usually get the gist, and a few of you out there with your multi-colored highlighters, your stacks of Post-it notes, just taking all the notes. All right, let's switch to the other side of things, planning and doing research. So how confident do you feel in your ability to design and conduct a research study? Not at all confident. I wouldn't know where to start. I'd need a lot of guidance. I could help with parts if someone else was leading. I could design or run a study with some support, or I'm ready to design the next big study. All right. And this is exactly what we see across massage therapists. So we have many massage therapists because in our education and in our practice, we don't naturally have opportunities to engage and create research. And so it's quite natural not to be very confident or to feel like you need a lot of guidance. By going through education and adding research afterwards, that's where often we find people who are feeling a little bit more confident in engaging in that research capacity. One more question for right now. So the final question is, when you think about your role and you think about research and what that means to you, in your role as a practitioner or an educator, an advocate, or whatever fits you best, what would be the most valuable outcome of building common ground through your research role? So if we're thinking about interprofessional collaboration and care, how could speaking the language of research help you to connect with others, or how could it serve yourself, your patients or clients, your practice, or your community? So we've got some great ideas already. Some shared knowledge to improve client outcomes. Absolutely. And we see literature starting to share this with us. Acceptance as a professional. That is one of the fundamental components that I think really is an opportunity for us. Ability to speak the language that other healthcare professionals speak. Absolutely. We're going to talk more about that. Being accepted by their healthcare professionals to enable us to work together and support clients. Supporting professional development, evidence for massage therapy, developing a holistic plan, being part of the care plan with other practitioners, feeling competent, establishing relationships. These are all fantastic. Knowing enough to support clients and know who to speak to. Absolutely. Better outcomes. Recognition, acceptance, acknowledgement, shared information. So good. These reflections really remind us that research has the potential to connect our work, our professions, and the people we serve. As you guys have mentioned, it is both a language we can share and a process we can engage in. And it's through that potential that research becomes a shared foundation where collaboration can grow. So on one level, research and the common ground of research is about language. Healthcare already has, to some extent, a shared language, those terms and measures that cross professions. But the way that professions use, define, and sometimes protect that language can contribute to the othering that happens during professional identity socialization. But research offers us another path. For many healthcare providers, research becomes an added language, one that builds on healthcare's shared vocabulary, but is just different enough to open new possibilities. Research has words and structures that are recognizable across disciplines, things like study design and participants, outcomes, analysis. And these terms aren't owned by any one profession, and so that makes them a lot easier to share. Most of us learn research language not by conducting our own studies, but by reading and interpreting the work of others. Each time we engage with an article, whether we're examining its design, considering its outcomes, or weighing the interpretation, we're strengthening our fluency in the shared vocabulary of research. Over time, that fluency helps us to enter interprofessional conversations on more equal footing. And you all mentioned that in terms of some of the opportunities that we have. When massage therapy outcomes are expressed in this language, when we talk about pain scores or mobility measures, quality of life indicators, reduced anxiety, they become legible across professions. They shift from being our outcomes to outcomes that every profession cares about. And this is how research language is a bridge. It gives us a way to tell our story in terms that invite others and creates opportunities for authentic collaboration. But research isn't just a shared language. It's also a shared process, and one that can serve as a connection point across professions. When you're designing a study, asking a clear question, collecting and analyzing data, these steps are a framework that every health profession can step into. It's a process that equalizes participation and creates space for diverse perspectives to collaborate. But I do want to acknowledge that not everyone feels confident in their research literacy or capacity. We saw in our room today, we have a diversity of perspectives and experiences and confidence, and that's important to acknowledge. The process of research can feel like learning a new language, because it is, and it's one that requires mentorship, practice, and patience to navigate. When we acknowledge this challenge, it's the first step to creating the support people need to take part. But I also want to assure you that research isn't as far removed from our practice as it sometimes feels. The process of research, so if you think about it, asking questions, gathering information, testing an approach, evaluating the results, closely mirrors clinical decision making we already use with our clients every day. The difference is often one of scale and structure, not substance. And recognizing this overlap helps make research feel less foreign and more like a natural extension of our practice. The shared framework of research is especially important, in my opinion, because many health systems, including here in Australia, have massage therapy outside mainstream structures. Without comprehensive regulation, without stable public funding, and with uneven recognition, we are easy to overlook. But when we join in the research process, those barriers don't define us in the same way. And building common ground doesn't have to start with large-scale trials, as I said already. It can come through smaller practice-based studies, community research projects, or even by contributing to multidisciplinary initiatives where massage therapy is one part of the picture. Each time we stepped into that shared process, we demonstrate that massage therapists can work within the same frameworks as other healthcare professionals. Each time we engage in research, we show what's possible. But showing up once is different than being ready to participate consistently and meaningfully. So when we're trying to strengthen our position, we need to prepare ourselves and our profession so when opportunities arise, we're ready to step into them. Strengthening our position starts with education. At entry to practice, massage therapy students need opportunities to learn how to find, understand, analyze, and apply research in ways that feel practical and not intimidating. This is the foundation of research literacy, and it's where research capacity begins to grow. We also know that there are barriers. Research articles can feel overwhelming, the language technical, the statistics intimidating, and time for learning is always limited. To address this, we need approaches that make research more accessible. Bite-sized learning opportunities, mentorship, and communities of practice where questions are welcome. Building research literacy in this way not only supports safe, evidence-informed practice, it also equips massage therapists to eventually contribute to research themselves. And it's not just about students at entry to practice. For all of you already in practice, continuing education has an equally important role to play, giving each of you the skills and confidence to engage in research throughout your careers. At the end, I do have a link to some resources that you can start with or share with your colleagues. Second, strengthening our position also means weaving research into how we present ourselves. Imagine if every massage therapist website, marketing materials, or social media posts included one or two references to evidence about massage therapy's effectiveness. That not only builds trust with clients, it also shows other healthcare professions that we speak the same language. The barrier, of course, is that research often feels too distant from practice to use confidently. That's why we need accessible summaries, plain language resources, and examples that that practitioners can use in their professional materials. For schools and education programs, strengthening our position could be as simple as finding one interprofessional activity each year where massage therapy students learn with other students from other health disciplines. These activities don't have to be elaborate. They might be shared case studies, joint simulations, or collaborative workshops. But we do need to be honest that this isn't always the simple step that it appears to be. It requires reaching out of our own silo, across educational silos, and into our networks to find a willing co-conspirator. But that work and effort is part of the overall strategy. And finally, strengthening our position means being ready to step into opportunities when they appear. They often come in many shapes and sizes. Sometimes it might mean consulting on a protocol or lending your practice experience to shape a research question. Other times, it might mean joining a project as a co-investigator or helping to collect data in your clinic, or even serving as a participant or a reviewer. None of these roles are insignificant, and each one builds our capacity, our confidence, and our visibility within the broader health community. So, strengthening our position isn't just about waiting for the perfect invitation. It's about preparing ourselves individually and collectively to step forward when opportunities come. And that preparation can take many forms. So I'd love to get a sense of where you are right now, and we'll take a quick poll. Which of these steps do you feel is most realistic for you in the next 6 months? Is it finding and reading a research article, posting to social media about a study you read with your hot takes? Is it connecting with one member in your network to plan a student interprofessional education activity? Signing up to be a reviewer for the International Journal of Therapeutic Massage and Bodywork, shameless plug, or looking for an opportunity to contribute to a research project? Let's see what you think. Early, we've got finding and reading a research article. Ooh, looking for an opportunity to contribute to a research project has a good number, as does posting to social media about a study. I love the person who's going to be a reviewer on IJTMB. Thank you. We need you. And also really excited about the interprofessional education activity. Amazing. So when I think back to that first research team meeting with Trish, what stays with me is how the research process gave us common ground. As I mentioned, the titles and hierarchy faded, and what mattered was the work in front of us, the space where massage therapy, and this is a space where I think massage therapy can grow. Today, we've explored some of the ways we can prepare for that space through education, by building our research literacy, through how we present ourselves, by weaving evidence into our professional identity, by stepping into interprofessional learning, even in small ways, and by being ready to take opportunities, however small, when they come our way. For some people, these won't feel like small steps at all. They may feel very big, even daunting, and that's okay. By taking them, we move steadily towards something larger. Each effort contributes to making us more prepared, more confident, and more visible. Together, these steps strengthen our position by showing up, ready to collaborate, and by demonstrating the value we bring when we do. So as we close, I'd invite you to think about what feels most possible for you. If it's reading that article and talking it over with a colleague, great, do it. If it's adding that reference to your website, do it. If it's saying yes to helping with a small project, do it. Whatever it is, it matters. And each act is a step onto common ground where massage therapists can stand alongside other professions and collaborate to improve care. And that's where the future of our profession belongs. If you're looking to dive a little bit deeper, then I invite you to use the URL at the bottom of the slide. I'm not sure if you can see all the words because it is poorly positioned behind the thumbs up and the people. So it is after the slash, it's just research-resources.
Amanda,
And I also, oh, sorry, Rebecca.
sorry, when you finished, can you pop the link in the chat possibly? And
Absolutely.
we'll send it out when we send out the recording as well.
That is a great idea.
Thank you.
I will absolutely do that. And so I also want to acknowledge that I use generative AI tools during the creation of this presentation. They help me brainstorm ideas, test different ways of phrasing things, and even fine-tune timing and tone. But every slide, every word is reviewed and finalized by me to make sure it aligns with my personal and professional values and voice. So I invite you to feel free to use my email or any of the socials on this slide, and I can also pop them into the chat. And the QR code will take you to my website if you would like to connect later on. Thank you once again so much for inviting me to be a part of your event today. And I will be happy to answer any questions you might have, or if you don't have questions, I'd love to hear a little bit about what you're thinking about in relationship to research as a common ground for interprofessional care. Thank you.
Thanks so much, Amanda. It's been wonderful. Guys, if you have any questions for Amanda, feel free to pop them into the Q&A section. There's nothing coming through at the moment. People are probably still thinking.
Absolutely.
Just while we're waiting, Amanda, I just wondered if you could briefly, give people a chance to ask questions by talking a little bit about the International Journal for Therapeutic Massage and Bodywork, because I'd be interested to know how many people are aware of its existence and access it regularly.
Absolutely, it would be my pleasure. So the International Journal for Therapeutic Massage and Bodywork is an open access massage therapy and bodywork specific journal. It is supported and sponsored and funded by the Massage Therapy Foundation and the Registered Massage Therapists Association of British Columbia. I have the privilege of serving currently as the executive editor and editor-in-chief. Dr. Sarah Fogarty, who I believe is here today, is one of our associate editors, as is Dr. John Winslow. And so we look for articles on all kinds of things. We have three sort of sections of the journal. We focus on research, practice, and education, so very broad. And we accept articles, including, of course, your standard sort of research articles, your reviews, your meta-analyses, anything like that, your randomized controlled trials, your observational studies. But we also look for scholarly articles on practice. We also look for commentaries. So there is a wide spectrum, and I invite you to visit. The website is ijtmb.org. I'll also pop that into the chat once I'm done so that you have all of the different places that you can visit.
Thank you so much for that, Amanda. We've just had a couple of questions pop up. So the first one is, what are the opportunities for research available to massage therapists in Australia?
That is a great question, and one that I may not be the best person to respond to. But I do know that there are some colleagues on the session today that might have some ideas and be able to share some ideas.
Yeah, thank you so much. Yeah, Dr. Sarah Fogarty is in the chat, so she might have some answers to your question.
I just promoted her to panelist status, so she could
Okay.
in very quickly if she feels inclined, but the chat's fine as well, Sarah.
Leave it up to her.
Hello.
Hi.
All right, I'm in the middle of, I'm hoping, no, my child is singing Thunderstruck. I knew. All right, let me just go back on.
All right.
I'll be back.
Not a problem. We do have another question. So while we're waiting for Sarah, I'll just read this out. It says, how long does it take for research to come down to practicing massage therapists? I've heard in interviews with research professionals, it can take up to 20 years for research to land in GP and doctors' offices. Is that applicable to our space?
Yeah, I think one of the disadvantages is that we haven't studied that in massage therapy. When I did a study in my master's around awareness of massage, of research by massage therapists, it did show that many people were not aware of some of the current literature that was out there. And so it was more current than 20 years, so it's entirely possible. I can't say an exact number of years, but I think it is reasonable to say that it is longer than we would like it to be. If you think about the process of an idea coming up, that initial study to look at feasibility or to look at effectiveness, then if there are positive results, we need it to be replicated. Often before something's put into practice, we then need some kind of a systematic review to see that it is demonstrating that pattern across different populations and different repetition of whatever it is that's being studied. And even then, someone needs to do a summary of it. It needs to get into our education. Often, if we think about things like entry to practice examinations or textbooks, we know that there's a life cycle and a timing for those. So yes, unfortunately, it does take longer than we would like. However, things like enhancing massage therapists' research literacy and having the ability to go directly to the research evidence allows people to contemplate whether it's something that they would like to try in their own practice. And we know one of the downsides of massage therapy research is that there's so many nuances to individual practice and the individuals that we work with that sometimes by the time it gets to this larger systematic review, it's lost some of the detail that's helpful for us. So what I mean to say is that there are moments whereby massage therapy practitioners can see something in the literature and try it out in their practice, and it may be beneficial for the people that they're working with. And so in that instance, we might be able to move some of these things more quickly, but certainly not consistently across the profession.
Okay, I think Sarah's son's singing, so I don't think she's going to pop back online. Is there any other questions that anybody would like to ask before we pass it on back to Karen?
I'm going to do a terrible thing and make a comment, not question or ask a question. I just wanted to give a heads up. I'll see if I can find the link and I'll pop it in the chat. But earlier in October, I think it was, Sarah Fogarty, who has a wonderful singing son, did a free webinar for AMT members on case studies, and it was the introduction to how you might go about doing a case study. So when I find that, that's freely available to AMT members. It's a nice way to get a little bit of a handshake with you know, a particular place in the hierarchy of research, if that makes sense.
Absolutely, that's fantastic.
Oh, there's no more questions, but lots of thanks in the chat. I think everyone is.
Well, thank you so much for having me. It's been great.
Yeah. All right, we'll pass it back over to Karen for the time being. Thank you so much, Amanda. Really appreciate your time.
My pleasure. Thank you.
Thank you, Amanda. I'm just reading one of the comments in the chat from one of our attendees today, Julie, and she says, never heard such good storytelling and inspiration from a researcher before. Thanks, Amanda. Love the way you relate your talk to massage therapists. So thank you very much, Amanda. And thank you, Julie, for your comment. That's beautiful.